Good afternoon, everybody, and thank you for being here. I'm going to read a little bit about public comment. Any citizen desiring to address the hospital board should turn in the speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Thank you, everybody. Just before we kick off, I'm going to let everybody know who is in the audience that we have decided to go back to the 5 minutes for speaking. If there is less than 10 people to comment, just to kind of gauge time frame, and if we don't have an extended agenda for the day. So today, we'll see where we're at that time, but if that is the case, then we will extend it. So just want to let you know we covered that and we are happy to accommodate. Also, just a note for everybody stranded out of the country and yes, speak out. So with that, we will move forward. Can I get an approval of the orders of the day? So, all in favor? Yes. Thank you. And can I get an approval for the minutes of the meeting on November 28th, 2023? So, thank you. Second. And all in favor? Yes. Yes. Any opposed? Motion passes. Great. With that said, in your board packet, I would like to ask for a motion to approve the appointments that I represented as set forth in the grid attached. It's just a couple of pages. These are the community members that are all in their second, they are all in their second year of their term, and they will expire on 2025. People I have appointed and would like your approval. Can I get a second? And all in favor? Motion. Oh, I guess I should say any opposed. Is anybody opposed to this? Okay. Motion. Next up is our Excel award, and David Barrett is going to present.
Thank you, Ms. Lodge. I have 2 Excel award winners to announce today. First off is our Excel award winner for November 2023, Meredith Johnson. Meredith. Congratulations. All right, I'm staying by that. So, Meredith Johnson is a multi-skilled tech in our neonatal intensive care unit. Meredith has been a member of the Sarasota Memorial team since 2006. Co-workers say she is a model for all its employees. When patients and family arrive in the NICU, Meredith is one of the first staff members they see, and she makes an excellent first impression. Warmly welcoming everyone, she also maintains a positive demeanor, even under the most challenging circumstances. Meredith is described as a wonderful team player and highly organized. She works hard to keep the unit stocked and improve the workflow so everything runs smoothly. Meredith is also the primary clinical coach for new hires. Her peers feel very fortunate to have her as a preceptor, and she has a vast knowledge base in her role in the NICU. Meredith is truly admired, and we thank you so much for everything that you do on behalf of the community. Meredith, this time, I'm going to give you this plaque. There you go. All right. So let me So an Excel award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers and make an extra effort in the quality and care of our patients and families in the community. Hospital board and administrative staff at Sarasota Memorial Healthcare System recognizes you, Meredith Johnson, with the Excel Award for the month of November 2023, sent by both myself as President and CEO and Sarah Lodge as our board chair. So let's give you congratulations.
Well, first of all, I just want to say thank you so much. It's really nice to be about it. I'm very fortunate to work with an amazing group of people. I was in here earlier. Really work with an exceptional group of people. Everyone, thank you. It's just amazing. Wonderful team. I've been here for 17 years. I found home in Mickey 12 years ago. Met some my very dearest friends. Very big honor. Thank you so much.
So next, I'm also pleased to announce that we have an Excel Award winner for December, which is Jose Engel, Physician Assistant 3 to GI. Jose, come on down. So Jose has been in the organization since 2013. His colleagues say that his decision to patients is second to none, and his bedside manner is exceptional. Jose cares for a very acutely ill population, yet strives to make each patient's recovery process as smooth and comfortable as possible. He knows his patients very well, which allows him to plan their specific needs and ensure they receive stellar care. His communication with patients and family is always clear and respectful, and he expresses optimistic expectations that help patients reach their full capacity. Jose also is highly responsive to concerns from nursing. He goes out of his way to support staff who are managing complex cases and makes himself available to answer questions and assist at the bedside. Both patients and staff appreciate his positive energy, his expertise, and compassion. In fact, one nomination said that everyone is always thrilled to have Jose when he arrives in the unit. There's no higher praise than that. Thank you so much for everything that you do. Wow. Someone can read the whole thing again, but we're putting you in the Excel Word, and it's signed by both myself Lodge as well. Okay, so let's say what I just want to say thank you. I thank the people that work with the system quality. Certainly helps come in and do your job every day, and I get to work there. Thank you. Thank you. Thank you.
I'd just like to make an observation about both of our Excel winners, and this is actually something that happens every time. You all are here to be recognized for your extraordinary work, and you end up recognizing the teams with whom you work. And I really think that is a hallmark of so many of our employees, is that they know that they can be their best when the people around them are at their best. And so I love seeing your staff members take pictures and give you standing ovations, which you most clearly deserve. But I think it is a great testament to your humility and your ability to care well for patients when you turn that attention back to the people you work with. So kudos to you. Thank you.
Thank you, Fred. Next on our agenda is the medical staff report. I don't think Dr. Federica has anything, so Dr. Karen was online. Dr. Karen, can you hear us?
Yes, can you hear me okay?
Yes.
Okay. Yeah, I'm asking for a motion approving the updates of the Sarasota Memorial Hospital Venice ECC Neuroscience Admission Guidelines for the medical staff rules and regulations as recommended by the SMH Venice Medical Executive Committee.
So,
Yes.
Any opposed? Great, motion passes. Thank you, Scott.
Thank you. Appreciate it.
Next is our secretary's report, Sharon.
Yes, thank you. On our calendar for Tuesday, February 27th, from 9 o'clock till 9:30 is the closed session hospital board meeting. From 9:30 to 11 o'clock is our quality committee. On Tuesday, March 26, 2024, from 9 to 10:30 is the finance committee. That's talk about them. Is that better?
Yes.
Did y'all hear the previous date I mentioned?
Do you want to just start over?
Okay, let me start over. Our board calendar, starting Tuesday, February 27th, 2024. From 9 to 9:30 is the closed session hospital board meeting. From 9:30 to 11 is the quality committee. On Tuesday, March 26th, 2024, from 9 o'clock till 10:30 is finance committee. 10:30 till noon, mission and planning committee. Noon to 12:30, closed session of the hospital board meeting. 12:30 to 2 o'clock, board lunch, issues and financial review. And 2 o'clock to 4 o'clock is our board meeting.
Appreciate it. And Bridget, our treasurer's report.
I move approval of the Adex and charity care for the month ending November 30th, 2023, in the $1,111,000 and December 31st, 2023, in the amount of $16,700,000.
Yes, second. All in favor?
Yes.
Yes. Any opposed? Motion passes. Thank you, Bridget. Next on the agenda is Jeff, regarding our financial report.
Thank you, and good afternoon. This is financial highlights for the public hospital district through December of 2023, which is one quarter, 3 months of our fiscal year that will end next September. So this is fiscal year 2024. Our total revenue on the rate agency format, as I mentioned, for the entire health district, otherwise known as our health system. Our month to date, so this is December, the graphs, the bar chart on the left, an actual revenue amount of $160,266,000 versus our budget of $151,092,000. The bar chart to the right is year to date, so 3 months of our fiscal year. Our year to date actual revenue is $463,972,000 versus budget of $446,810,000. Next slide is our total. For the month of December, they were $152,499,000 actual versus a budget of $144,006,000. Year to date, our actual total expenses $441,246,000 versus a budget of $427,275,000. Next slide is the resulting operating income. So for the month of December, we had an operating margin of $8,283,000 versus a budget of $7,085,000. That's an operating margin percent of 5.2 actual versus a budget of 4.7%. Fiscal year to date, we're at an operating margin of $24,223,000 versus a budget of $19,535,000. Also an operating margin year to date of 5.2% actual. The budget is 4.4% actual. Moving on to some of our volume statistics. So these are fiscal year to date numbers. Our average daily occupancy for both hospitals, 859. The bar chart all the way to the left. And then in the middle of that section, our budget was 166. That is in a length of stay for the Sarasota campus. Our actual year to date is 4.43. versus prior year 4.76, and for Venice, our actual is 3.7 versus prior year 3.87. The bar graphs to the right, admissions and observation cases total of 19,747 versus a budget of 18,344. Surgery cases, year to date, 8,135 surgery cases versus a budget of 7,889. And the bar graphs to the right are births, 1,217 versus a budget of 1,124. Next slide, outpatient and ER registrations for the hospitals. These are the outpatient registrations in the bar graphs to the left, which show for actual year to date, 149,722 versus a budget of 150,756. And for ECC registrations, 43,477 versus a budget of 45,335. And our final slide is our case mix index, level of acuity inside the hospitals. If you see the charts all the way, the group of 4 all the way to the right on this graph is our fiscal year to date 2024. So again, 3 months into our fiscal year. The case mix index, all case mix index for Sarasota campus was 1.85. The Medicare only case mix index is 1.90. For Venice, we're at a case mix index for all patients of 1.52, and very similar for Medicare only at 1.50. That concludes my report, unless there's any questions.
Thank you, that's we'll move on to our committee reports. Sharon, would you like to go over finance and audit, please?
Yes, I have a report to the Audit and Finance Committee. First of all, the minutes of the August 21st, 2023 Finance Committee were approved, as well as the minutes of the July 17th, 2023 Audit Committee were approved. Next, we have Todd Webster, CPA of KPMG, who presented the draft results of the audit of the fiscal year 2023 financial statements of the district. He stated that the audit went well and reported the auditor's required communications, including significant audit areas, management judgments, and estimates used in preparation of the financial statements. Based on the foregoing, I move acceptance of the fiscal year 2023 Sarasota Memorial Healthcare System consolidated audited financial statements as recommended by both the Audit and Finance Committees.
So,
Second, all those in favor say yes. Any opposed? Motion passes. Next, we have Maureen Henry, CPA of Walters and Associates, presented the draft results of the audit of the fiscal year 2023 financial statements of the Sarasota Memorial Healthcare Retirement Plan. She stated that the audit went well and reported the auditor's required communications. Ms. Henry reported that the improvements in investment returns this year increased the plan's funded status to approximately 93% from 86% last year. As such, I move acceptance of the fiscal year 2023 audited financial statements of the Sarasota Memorial Hospital Healthcare Retirement Plan as recommended by both the Audit and Finance Committees.
so moved.
All those in favor say yes.
Yes.
Any opposed? Motion passes. Next, we had Jeff Limbacher, Chief Financial Officer, presented a request for approval for a 3-year renewal of the Walters and Associates SMH Retirement Plan audit engagement, as the current engagement expires with the fiscal year 2023 audit. Now, I move to renew the engagement of Walters and Associates in substantially the same format and with the same material terms as the proposed draft engagement letter presented to the Audit and Finance Committee to conduct the annual external audit of the SMH retirement plan's financial statements for fiscal years 2024, 2025, and 2026, as recommended by the Finance and Audit Committees.
So moved.
And a second, all those in favor say yes. Any opposed? Motion passes. Next, we have Bobby Pettit, Controller, who presented the updated recurring wire transfers and ACH and other payment policies for approval. I move approval of the updated recurring wire transfers and ACH and other payment policies as recommended by the Audit and Finance Committees.
Can we get a second?
All those in favor say yes.
Yes.
Any opposed? Motion passes. Next, we have Todd Naz, Director of Audit Services, who provided an update on internal audit projects. Part of the presentation was given by Jeff Hartman of Productivity. I thought I had it right the first time earlier, but thank you for the correction. It's Productivity. So Jeff Hartman of Productivity LLC relating to audit procedures performed by Productivity on the construction invoices for the behavioral health pavilion and Venice expansions. No motion is necessary. This is for information only. And finally, Todd Naz, Director of Audit Services, reviewed and proposed Audit Services Annual Audit Plan for 2023-2024. I move approval of the 2023-2024 Audit Services Annual Audit Plan as recommended by the Audit and Finance Committees.
Second.
Okay, all those in favor say yes.
Yes.
Any opposed? Motion passes. That concludes my report, Madam Chair.
Thank you, that loss. I actually am providing and sharing some plastic apple. Investment committee met today. We are having some issues with speech. Bilal Minimum and Nicole Stoller of Northern Trust gave a presentation on board designated fund review, which included a review of the investment policy, economic activity, and interest rates on Northern Trust viewpoint going forward. Bilal and Nicole presented information on the board designated investment results as of December 31st, 2023. The enhanced cash fund had a return of 5.07% for the calendar year 2023, and the intermediate fund had a return of 5.68% during the calendar year 2023. Both portfolios are invested in high-quality securities. Next, we had Tim Sant of Mercer give a presentation on the SMH retirement plan investments, which included an overview of the retirement plan investment policy and performance of various market indexes. The retirement plan portfolio assets had a return of 7.89% during the quarter ended December 31st, 2023, and 13.84% during the last year. This performance has been largely driven by the gains in asset classes except for the real assets. Tim also reported that as of December 31st, the retirement plan fund had an estimated market value of $419 million. Leaving the retirement plan to be approximately 95% funded as of December 31st, 2023. Tim recommended approval to remove Russell Multi-Manager Bond Fund and replace it with the Fidelity Institutional Asset Management Fund and the fixed asset income asset class. At this time, I move to remove the Russell Multi-Manager Fund and replace with the Fidelity Institutional Asset Manager as recommended by the investment committee. Can I get a second? Great. All in favor?
Yes.
Yes.
Any opposed? Motion passes. Thank you. Next, we had David Evans review the amendment to the SMH Retirement Plan Investment Policy Statement that is necessary to comply with new state regulations. The plan has historically compiled these amendments, so no changes in practice will be evident. I move at this time to amend the SMH Retirement Plan Investment Policy Statement as recommended by the investment committee. Can I get a second? Thank you. All in favor?
Yes.
Any opposed? Motion passes. This concludes my report. And next up is David to go over the president's remarks.
Thank you, Madam Chair.
I'm sorry. Yes.
Thank you again, Madam Chair. I'm going to start my report like can you hear me all right? So, like I do every month, I'll talk about the organizational report. We have 5 areas of concentration that we report on, and we look at their service, people, quality, finance, and growth. We have our goal, and we have what our score is. So the first area we look at is service, and we look at our likelihood of recommending, and we have a goal of having 8 out of 10 areas that we survey, we at or greater than 75th percentile. Happy to report that we are actually 9 out of 10 year to date, and I'll show you the details on that. In the people section, we have our goal is to have our new hire retention, which is a percentage of regular full-time and part-time employees that were hired during FY 2004. So there's still employee here for the new year. We have a goal of having that number be 83%, and we are exceeding that at this point at 93%. The quality section, we have a goal of having our infection prevention, which is our combined overall standardized infection rate, be less than 0.8. I'm happy to report we're exceeding that as well at 0.57. Just to remind everyone, national average for now, expected number is 1. So right at it. In the area of finance, we have, and we heard from our CFO just a minute ago, Jeff Blubacher. We have our operating margin is our goal in that. We have a goal of hitting our budget, which is 5% operating margin, and we are projecting to exceed that right now at 5.2%. And then finally, in the growth area, we have 2 goals. Our first one is our inpatient admissions and outpatient observation patients to be at 75,406 or higher. We are projecting to exceed that right now at 81,071. And our outpatient registrations to be at 1.18 million, and we are falling coming in a little bit lower than that at 1.16. Looking a little deeper into the patient experience report card, as I said a minute ago, we did achieve 9 out of 10 areas, but I had written 75th percentile. You can see there, you see the 10 different areas in the survey on the far left. In the middle column is our score. The next column over is the national median score. That's finally the 75th percentile score, which is the based. We were happy to report this past month that we did receive a $25 million gift for transformative research on our campus. A $25 million gift from the Jerry and Karen Chowsky Foundation is the latest in the series of family donations for transformative research and growing top-tier positions to the region. Jerry and Karen Chowsky and their family foundation have been quietly helping our health system expand its education and research program for almost 20 years now. The Chowsky's latest donation was a catalyst that allowed SMH to break ground on a new research and education last summer. When it opens in 2025, the Chowsky Research and Education Institute will be a state-of-the-art center that expands research and training opportunities for physicians and clinicians. We're very thankful for that. SMH celebrates a new day for mental health. Last month, hundreds of community members, mental health advocates, donors, and other toured Sarasota Memorial's new state-of-the-art Cornell Behavioral Health Pavilion, participating in a week of grand opening activities before the new facility opens to all patients. The pavilion is named after Brian Cornell in recognition of their $10 million donation to support the creation of the new facility. Sarasota Memorial is the only hospital in Sarasota that provides behavioral health care to patients of all ages. The pavilion offers a full array of inpatient and outpatient services for the community. Next up, we have our governor. Our governor names two SMH leaders to state advisory councils. So congratulations to two Sarasota Memorial leaders who were recently appointed by Florida Governor Ron DeSantis to serve on advisory councils that impact critical services provided throughout the state. First up is our very young Bert Reiner, Sarasota Village County Hospital Board member, who was appointed to the Florida Interagency Coordinating Council for Infants and Toddlers, which assists the Florida Department of Health in implementing a statewide system of programs providing early intervention services to infants and toddlers with disabilities, as well as their families. The governor also appointed SMH Trauma Program Manager Jennifer Sweeney to the Florida Trauma System Advisory Council, which creates recommendations on issues for impacting emergency and trauma care. Congratulations to both of you. Agreement reached with United Healthcare. At the close of 2023, Sarasota Memorial reached an agreement with United Healthcare on a new contract that allows patients enrolled in United's Medicare Advantage and commercial plans to continue to have uninterrupted in-network access to our hospitals, urgent care, and outpatient centers, and first physicians providers. The new contract did take effect in January 1 and had no lapse service. Successful gala helps support high level of care. We're grateful for the Sarasota Memorial Healthcare Foundation and our many friends in the community who gathered together this month to support SMH. An incredible $1.4 million raised at the 7th annual hospital gala, which featured Sarasota Memorial's Trauma Center, the only trauma program in Sarasota. SMH welcomes the first baby of 2024. A girl at SMH Sarasota was born at 1:56 a.m. January 1st, and was Sarasota Memorial's first baby. The mother baby nursing team gave the mother a special gift filled with gifts for the new baby. The SMH Venice team presented a similar gift basket to its first mom. Births followed the record-breaking year as Sarasota Memorial saw more than 4,800 babies born at its two hospitals. SMH Sarasota delivered 4,449 babies in 2023, including 77 sets of twins and 1 set of triplets. SMH Venice delivered 385 babies, including 5 sets of twins. Thank you to the teams of both our campuses. As we frequently have, always really have, is physician lectures. We focus on the various areas this month in February. We're focused on cardiac care, and you can see, or probably can't read it because it's so small, but it's all the various physicians that are going to kind of do lecture series here open to the public. We invite anyone from the public to come. I would just encourage you to go onto our website and reserve a space. It's free, but make sure that you can have a seat when you get there because they do fill up pretty good. And that is my report. Is there any questions?
Do you have any questions for me? We have no consent agendas, so next will be public speakers. We actually have 11 speakers, and at the beginning I said if we had 10, we would move to 5 minutes, but we will grant the 5 minutes, just try to be cognizant of time and of everybody here and respectful. So we can go ahead and move forward with that. Yes. So the first one up is John Copel. And then next will be Saul Philstein.
Thank you, Madam Chair. I live in Sarasota, and I know there's a lot of good things the hospital has done for its patients. However, when there are things they do that are harmful, they need to be pointed out. SMH puts out there as a research hospital. It has not performed any of the data analysis that has been requested regarding comparative data between 2018 and 2023. The incident of heart attacks, strokes, cancer, blood clots, miscarriages. Why not? More than 2.5 million serious adverse events, and 37,000 deaths due to the virus members the COVID vaccine that have been documented at the VAERS vaccine adverse reporting system. It seems strange that the board isn't acknowledging any increase in these horrific events. You wouldn't be hiding it, would you? The CDC stated anyone that saw an adverse reaction after COVID vaccine needed to report it to the CDC VAERS site, regardless of whether or not they thought it was related to the vaccine. It needed to be reported since these are new gene therapy technologies and they were emergency use authorization only, not ever FDA approved. SMH reported only 3 vaccine adverse events in over 1 year's time as per their own committee report. I recently heard a story where a patient with former chief of staff was being treated for a new serious heart issue which developed after she took the bioweapons vaccine. She was told there was no correlation, but then asked if the office had seen increased heart-related issues. She was told yes. Again, are you hiding? Florida Surgeon General Joseph Ladapo just last week said, in his words, I am calling for a halt to the use of mRNA COVID vaccines. DNA integration poses a unique and elevated risk to human health and to the integrity of the human genome, including the risk of the DNA integrated to sperm or egg gametes to be passed on to offspring of mRNA COVID-19 vaccine recipients. The patron saint of COVID, Tony Mengele Fauci, recently testified under oath for the U.S. House of Representatives. He said, in his words, I don't recall more than 100 times in response to lawmakers' questions about the COVID-19 pandemic. Fauci also admitted that the 6-foot safety zone sort of just appeared. It was never based on scientific evidence. Is the science here at SMH political science, or should we just follow along? This month, a federal judge ordered the CDC to disclose the entirety of the critical COVID-19 vaccine safety database to independent researchers and the public. What are they hiding? Also, the lawsuit was filed against Gilead, which due to remdesivir caused kidney damage. What are they hiding? Please let doctors here treat their patients based on their own experience of treating patients instead of the dictates of the hospital. That includes allowing doctors to prescribe ivermectin and vitamin C, which has long been approved by the FDA. Does SMH pressure its staff, doctors, and nurses not to report on any correlation between the so-called COVID vaccine and the previously mentioned serious issues, of which many are life-threatening? Since this is an election year, the World Health Organization has already planned the next pandemic with disease X, which they say will be far more deadly than COVID-19. In Bill Gates' words, this will get their attention. This will allow the new order to say we will need mail-in ballots for everyone's safety. That will help them to steal the election again from President Trump. Please don't fall for the next pandemic and help stop the new order eugenics agenda, following the population with vaccines, with bioweapons, which are disguised as vaccines. Thank you very much.
Thank you, appreciate it. Next up, Sal Kilstein, sorry. And behind him is going to be Timothy.
I'm Saul Kilstein, full-time resident of unincorporated Sarasota County. I'll start out with the extra 2 minutes as a point of personal privilege. For the first time in 2024, I'll ask the board not to allow Anthony Fauci or anyone else to be compared to Joseph Mengele, the angel of death. As a Jewish member of this community, I find that outrageous, offensive, and should not be allowed in this forum or any public forum in this county, in this state, or in this country. Anti-Semitism is a disease that has to be wiped out, and I ask the chair to enforce the rules of this committee that were announced last year and not allow it to be repeated.
Will do.
SMH prides itself in being a center of medical excellence and cutting-edge scientific research. It aspires to attract and retain some of the best and brightest medical talent, along with outside funding, to support their work, such as your recent $25 million gift and additional research grants. Working against that historical commitment to excellence in medical advancements is a dangerous national, state, and local effort to undercut your mission through misinformation and disinformation amplified by digital algorithms. It's my belief and strong recommendation that it's no longer safe nor sufficient for this board and this institution to remain passive or quiet in face of these assaults on science. It's no longer in your interest to discount or ignore the so-called medical freedom movement. You need to stand up for health, stand up for science, and stand up for your basic mission. I'm not asking you to become political. You're a not-for-profit organization. But I am asking you to use your platform, your media outlets, and your well-earned credibility in this community and in this state to counter the falsehoods, such as what you just heard, the misinformation, such as that put out by the Surgeon General, the political Surgeon General of this state, and the media anecdotes, not science, not the standard for academic and science research that are causing unnecessary deaths and hospitalizations. Silence and full-page ads that list the quality awards of this institution are no longer an adequate and sufficient response. Thank you.
Thank you, Sal. Timothy Wagner. And behind Timothy is Donna Gerlach.
Good afternoon. My name is Timothy Wagner. Thank you for your time and opportunity to address this board. I'm here to speak about the vaccine adverse event reporting system for the VAERS. So what is VAERS and why is it important? VAERS is a national early warning system to detect possible safety problems in the U.S. licensed vaccines. VAERS is co-managed by the Centers for Disease Control and Prevention and the U.S. Food and Drug Administration. VAERS accepts and analyzes reports of adverse effects following vaccinations. VAERS is not designed to detect a vaccine causes an adverse reaction, but it can identify unusual or unexpected patterns of reporting that might indicate possible safety problems requiring closer look. So why is this important? As a retired nurse, I have never heard of VAERS. I've been out and told you what the requirements were. Our healthcare professionals are required to report to VAERS. As it turns out, yes, we are. For the HHS.gov website, healthcare providers are required by law to report to VAERS any adverse event listed in the VAERS table of reportable events following vaccines that occur within a specific time period after the vaccine. An adverse event listed by the vaccine manufacturer is a contraindication to further doses of the vaccine. Healthcare providers are strongly encouraged to report any adverse event that occurs after the administration of a vaccine licensed in the United States whether or not it's clear that a vaccine caused the adverse event. So how are we doing in reporting adverse events? Not very well. A 2010 CDC Commission study claimed that less than 1% of all adverse events are reported to VAERS. The VAERS project, which continues continuing education on VAERS to healthcare professionals, did a preliminary survey of nurses in Indiana. The results were enlightening. The VAERS project asked if you heard of VAERS. 6% reported they had not heard of it. 26% reported they heard the name, but weren't aware of much more. 68% reported they were aware and had working knowledge, but 76% did not know where to file a report. This is concerning. According to Dr. Latko's letter to Dr. Caleb and Dr. Walensky from the CDC and the FDA, academic researchers around the globe have seen troubling safety signals of adverse events with the mRNA COVID-19 vaccine. Their concerns are corroborated by the substantial increase in VAERS reports from Florida, including life-threatening conditions. Florida saw a 1,700% increase in reports after the release of the COVID-19 vaccine, and life-threatening conditions increased 4,400%. And we know that VAERS is underreported. We need increased education of VAERS reporting to be able to track adverse events and to increase safety to our population. I encourage a mandatory education program for Sarasota Memorial Healthcare employees. Thank you for your time.
Thank you. Next, Donna Greenlock. And behind Donna is Allison.
Good afternoon, Chairman Lodge and other members of the board, and thank you for giving me this time to speak to you. My name is Dr. Donna Gerlach, and I am a retired physician, author, and certified menopause clinician. I moved to Sarasota County and currently live in Sarasota County after practicing medicine in Virginia for 38 years. We know that we can learn from history. So I'd like to talk with you a little bit about history, specifically about times where people in power, for various reasons, have lied about science. Let's first look at Copernicus, a physician and astronomer, who just before his death in 1543 declared that the Earth rotated around the sun rather than the opposite. His ideas were mainly ignored until Galileo, well over 50 years later, argued that he believed that Copernicus' thoughts were correct. The church didn't like that because it challenged their prevailing doctrine that, of course, the Earth was the center of the universe. So in 1633, almost 100 years later, Galileo was promptly arrested for heresy and jailed until he died. The church continued to censor the idea that the Earth revolved around the sun for another 100 years before the truth eventually seeped out and their censorship no longer worked. Then let's go forward to more recent times. During the late 1960s to 2000, when I was practicing actively, there were hundreds, perhaps thousands of research papers that showed that hormone replacement therapy was good for menopausal women, and it made them live longer, have less heart disease, etc. The standard of care at that time was to begin estrogen replacement as soon as women hit menopause and continue it for life. The outcomes were excellent, and I have many patients that can tell you that. But then estrogen products became generic, and other products were more profitable than estrogen. So the NIH published a study called the Women's Health Initiative in 2002, claiming that 40 years of data was hogwash, estrogen was poison, and it should be removed and shunned. There was also a massive media blitz at that time, 8 times more media than any other study, that scared women, and millions of women stopped their hormones, and a number of them died as a result of that. So now 2 decades later, after 20 years of hot flash darkness, we're still finally crawling out of the idea that estrogen is bad for women in menopause. Today, we're still recovering from the massive lies of Dr. Fauci and his CDC concerning the best way to handle an infection that was caused by a man-made virus that he holds patents for and helped fund with our taxpayer dollars. He slandered effective treatments like ivermectin to make way for his patented vaccine. As he takes his massive profits to the bank, current data suggests that the COVID vaccine has likely killed more people than it's helped in the years since it was first started. Fortunately, our Surgeon General, Dr. Latipo, has not been blinded by Dr. Fauci's lies, and based on true science, done by true scientists, he has called for a halt in the use of these dangerous injections. I applaud the fact that the Sarasota Memorial Healthcare System does not give the vaccine at this time, and I hope that the board will consider publishing Dr. Latipo's statement on their website so that the public can read it. Thank you.
Allison Erker. That's my Allison. We have Lisa Burlett.
Thank you very much. First, I'd like to recognize all the medical staff here for care for the sickest of the sick in our community, from their first breath to their last, and all that happens in between, so thank you very much. I'm here also to talk about the well-documented dangers of COVID-19 mRNA injections that are happening within our community. It's well-documented, in fact, that COVID-19 injections have led to the highest number of adverse event reporting than any other tracked vaccine since the beginning of the nervous system. It's also well documented that government agencies consistently told the public various untruths, including that the lipid nanoparticles would stay in their arms, but we now know that they're found in the testes, ovaries, heart muscle, liver, reaches the blood-brain barrier, and is transferred in breast milk from nursing mothers to infants. The public was also told that the mRNA injections would stop the virus. Those injected would not get it. Then we were told that breakthrough infections were rare. We now know, per a 2023 Cleveland Clinic study of over 48,000 participants, which concluded that the more injections you received, the more the immune system responded negatively, and you had a negative efficacy, and you got COVID more often. Let's not forget that those same agencies told the public these injections were safe and effective, yet hid 2021 safety signals from the military population that they were unexplained, that had unexplained inconsistency in myocarditis, pericarditis, miscarriages, blood clots, etc. Amongst our most fit and healthiest population following injections. Yet they told the public to get injected and inject our kids anyway. Now we're faced with another untruth, that the mRNA does not integrate with the human genome, whereby our leading scientists of the MIT Human Genome Project, and with corroborated findings from multiple labs, revealed recently that there are DNA contaminants and previously undisclosed materials in the injections, which cause and or reactivate cancer by inhibiting tumor suppressing genes, disrupt the immune system, and include known materials used to drive DNA into the nucleus. Increased mortality rates, cardiac issues in our youth, turbo cancers, and diet suddenly caused by these injections are related to the pandemic. Sudden cardiac arrest has become such an issue that during this legislative session alone, there are at least 3 bills across the aisle, regardless of your political stance, to combat these cardiac incidents in our schools, sporting events, and more generally as a public service campaign to recognize it and how to treat it. We are at an impasse here, where denial and pride are met with truth and evidence. It's often natural human hubris to defend a lie to preserve one's pride and to admit that they were fooled. The evidence is clear, and the majority of the population knows they've been lied to. My question is, how is SMH and the board going to respond going forward? Will you expose the lie, protect the public, and seek to heal the ones harmed, or will you allow pride and hubris to affect the halls of this hospital? Possibly, we can utilize the new $25 million research facility to help the vaccine and COVID-19 mRNA injection injured renew hope and healing. Publicly acknowledging and supporting the Florida Surgeon General's recommendation to halt the COVID-19 mRNA injections is just the first step. It is prudent, scientific, and preserves the integrity of SMH. Thank you.
Thank you. Next up, Lisa Rowlett, followed by Barbara Goff.
Before I start my comments, I just wanted to double check. There are 3 of us that were hoping to present a unified message in succession. And I just wanted to check, I think we got it in the right order, but are you showing Ravon and Michelle was Andrew? So I'm here today because I feel called to speak in support of Dr. Defante's request that he plans to make for a more robust review of his August 2021 experience as a COVID patient here at Sarasota Memorial, and also more thorough review for the other 8 cases brought before you last year. I feel called to show you why previous reviews of Dr. Defante's situation did not dig deep enough and did not reveal the areas you need to see. Where hospital policy appears to not have been followed and it threatened his life. You'll likely see that huge questions remain unanswered, and to get to the bottom of them, we'll need at least 2 physicians, one of his choice, one of Sarasota Memorial's. And I would like to request a similar arrangement for the other 8 cases as well. The physicians would each address specific unresolved questions and present the results to the board, and also do a thorough review, and the families invited to be part of that. That way you can assess the need for improvements in hospital policy. There are so many red flags that become obvious when you walk through what happened to Dr. Defante. As a very quick recap, Dr. Defante is a retired emergency medicine physician. He was admitted to Sarasota Memorial in August 2021 as a COVID patient. He became alarmed when his roommate, a 51-year-old marathon runner, was declining, and he agreed to be his patient advocate. It's documented in his records that he was given permission to review the charter. What I'm about to describe to you comes from information I've read in his police report, the Sarasota Memorial Security Report, select notes in his chart, multiple interviews he's given, conversations I've had with him, and other sources. I believe that what I'm about to share with you is true to the best of my knowledge, but it is my goal for you to independently verify everything I'm going to say. Both hospital records and public records reflect that he was extremely worried that his roommate was not getting the treatment he needed here, and that he feared for his roommate's life. Dr. Defante repeatedly asked nurses to let his roommate's doctor know that his failing roommate desperately needed help. And when nothing he did convinced a nurse to get a doctor, he ended up in the middle of the night calling an infectious diseases colleague so that together they could both try to convince the nurse to get a doctor. When that failed, with his roommate's permission, let me get back here, he issued a public cry for help on Facebook, alerting the public of what he believed to be poor hospital care and his belief of the urgent need for his roommate to get appropriate medical treatment. I'm told that records at this point reflect that his roommate's oxygen levels were in the 70s. After posting his public cry for help to Facebook, nurses told Dr. DeFonte he would be moved to another room away from his roommate. Dr. DeFonte says that he decided to leave the hospital of his own volition, AMA, so he could get help for his roommate outside the hospital. A nurse told him to keep lying in bed and they would bring him the necessary paperwork. But instead of receiving the paperwork he needed to leave, Dr. DeFonte was shocked when security unexpectedly entered his room. The security report said they were called because of the pictures of his roommate and staff members that he posted on social media. Dr. DeFonte says that security took away his supplemental oxygen and he was forced into 4-point restraints. Then another really strange thing happened. A doctor was called to assess Dr. DeFonte, and Dr. DeFonte tells me that he was diagnosed as psychotic. He was placed under the Baker Act, which means that it was determined that Dr. DeFonte was mentally ill and such a danger to himself and others that he needed a psychiatric examination. But Dr. DeFonte says there were no labs, no physical, no documentation that based on the chart review, this was completely out of character for him. There was no assessment of his oxygen levels, says Dr. DeFonte. He says there's no documentation supporting psychosis, which is what he says his diagnosis was. No documentation of hallucinations or delusional thought. The horrific following hours that Dr. DeFonte suffered through, left alone in 4-point restraints without his supplemental oxygen, appear to have been authorized, not based on patient examination, history, or labs, but instead based on anonymous hearsay.
Continuing with what you've shared. Instead of based on anonymous, unsubstantiated hearsay that was completely out of character with Dr. DeFonte's chart of notes, which just the previous evening had noted that he was a very sweet man. And actually, if it really were true that over the course of 20 minutes, Dr. DeFonte suddenly exhibited very unusual and unexpected, irrational, aggressive, and dangerous behavior. And there were 0 observations of mental illness or aggressive behavior for the entire 10 days prior to that. Then I'm told that would be an emergency situation, such as delirium that requires labs and an urgent evaluation to determine the cause, such as oxygen too low, a blood infection, a medication error, or something else. If it was true that Dr. DeFonte exhibited sudden, erratic, dangerous behavior, then I'm told the diagnosis of psychosis was a tragic misdiagnosis that could have killed him, since he ended up tied up in the room alone for hours with his supplemental oxygen taken away. And he says there was no oxygen monitor on him to alert the staff if he declined. He actually reached a point where he truly believed that there was a good chance he would die, tied up and alone in that room. But it's not looking like Dr. DeFonte exhibited sudden, erratic, and dangerous behavior. I would venture to say that for everyone here who has taken the time to become familiar with this case, we know in our heart of hearts that this retired physician in his 70s, a COVID patient on supplemental oxygen and on ICU watch, who had been advocating for his roommate care for a number of hours, he did not suddenly become violent and psychotic. The most likely explanation of what really happened is that he was unjustifiably forced into 4-point restraints after publicly posting criticism of the hospital. This is terrible.
Next up is Michelle Posey. Followed by Stephen Gavante.
Hi, and thank you for the time to address each one of you today. I'm going to pause from the Dr. Conte's story just briefly. Driving in, I was taken away by the behemoth facility y'all have here. It's been a while since I've been to this side of Sarasota. Groundbreaking in so many ways, right? In cancer treatment, in your heart pavilion. Even the reason why I decided to have my daughter here because of a high-risk pregnancy. I hope that we all hear this story with the same set of ears, that we love 99% of what you all do here. We rely heavily on what you do here, and we want to see this continue to be that groundbreaking facility. And as that groundbreaking facility, you're gonna have to take this serious. A 70-year-old man in 4-point restraints without oxygen. We can't let that be the narrative here because you're groundbreaking. You give Excel awards, so this should lay heavily on your heart. In order to make the decision to put him in restraints, there had to have been a number of things that happened. You need to review that. You don't even have to choose which side to believe in, honestly. You just need to decide that there are enough unanswered questions here that you want to know. You want to know, is your understanding of a diagnosis or psychosis correct, and was it supported? Or was this a tragic misdiagnosis of an emergency event that should have been immediately examined and treated? Or was this simply the case of unjustifiable, horrific use of force coupled with oxygen deprivation that could have killed a patient? The apparent highly irregular departures from Sarasota Memorial policy doesn't end here, you guys, because what comes next makes no sense either. Dr. Grafante's wife says she received a call from a physician at 7 a.m. 7 a.m. One who had not been the one involved in the Baker Act. And this physician said, your husband was Baker Acted last night. He doesn't need to be Baker Acted. I'm discharging. But Dr. Grafante was not evaluated by this doctor until 9 a.m. And under normal circumstances, he would not be discharged, right? With oxygen saturation levels that drops to 81% when walking. What discussion with staff and what other information enabled this second doctor to conclude that the Baker Act was inappropriately applied and that Dr. Grafante was not psychotic or a danger to himself or others, even before evaluating him? So the question before all of us is what procedures were violated that allowed this to happen at all? And what new procedures need to be in place to prevent a patient on ICU watch from unjustifiably being tied up in 4-point restraints 4 hours alone without the supplemental oxygen they need in such a desperate situation that they truly think they could end up dying here. I could substitute Dr. Grafante's name for any of ours. We all would feel the same way. That is Dr. Grafante's question, and quite honestly, it's my question, it's the community's question. And this is the question that the Quality Review Board asked. They haven't received the answer to that yet, or other essential questions. So this is now your question. These questions need answers, and the answers have not come from any of the prior reviews, where Dr. Grafante and the hospital did not each have separate doctors assigned to review the facts or to address these questions. It's kind of like asking for a second opinion, which I'm under the understanding it as part of the medicine practice, is asking for that second opinion. We need Dr. Grafante and the other 8 families, to be able to each choose a physician to review their records, and for you guys, Sarasota Memorial, to select a physician to review the records and present these findings at the board so you can determine if you truly excel and if your policy changes are warranted. Therefore, I ask that after public comments today, you discuss the information you've heard today. Don't go on as business as usual. This is unusual. And make a motion make a motion to allow for families to have their records reviewed, both by a physician of their choice and by a physician of your choice for Sarasota Memorial. And with the findings to be presented here, so you can determine if further action is warranted by you. Be the remarkable facility and the remarkable physicians we know you to be. Thank you.
Thank you. Next up is Dr. Gavanti, followed by Thomas Peter.
One opinion.
You can go ahead.
What's in front of you explain what I'm suggesting. Thanks, ladies and gentlemen of the board. Before you is the only note in my medical record that Dr. De Lucia, by Dr. De Lucia. It is a fabrication created to cover up health abuse and false imprisonment. It was reviewed by your quality review committee twice, and allegedly a third time by a Stanford professor. Medical standards for a doctor's note requires a history, a physical, usually some labs or tests, an assessment, and then a plan. This note has only a plan. In another part of my chart, Dr. De Lucia uses psychosis as his assessment. In this note, Dr. Lucia claims a history that, quote, somehow I gained access to my roommate's chart. If he had looked into the chart, he would have read that I was given access. That's on page 1102 of my chart. By the way, you also have a timeline of what's in the medical records. When a patient refuses to talk to a doctor, the chart is the main source of history. He continues to write that I had a sudden onset of erratic behavior. The correct diagnosis for sudden onset of erratic behavior is delirium, which is a life-threatening medical emergency. In my case, the most probable causes of delirium are hypoxia, sepsis, or being given the wrong drug, all of which require an immediate physical exam and labs. His plan is to ask for a psych eval in the future. He was aware that I had asked to be released AMA. SMH is a teaching hospital, and my chart was reviewed 3 times, and somehow it was missed that the chart note had no real history, no physical, no assessment, just a plan. When I asked Dr. Fiorica if this approach of no history, no physical, and no labs met SMH's standard of care, he couldn't bring himself to answer. I believe this board has a serious flaw in its quality review procedure. According to the security report, my roommate's oxygen saturation was dropping into the 70s, yet the nurses kept the doctor in the dark. Remember, the only thing he or I were asking was to talk to the doctor. This is a major procedural problem that needs to be addressed. The nurses knew the patient was tanking and refused to tell the doctor. Sarah asked how much would it cost to have an independent evaluation of the 9 cases brought before the board last year. And assuming that you use a doctor for the patient as well as one for the board, about $100,000. Britt wanted to avoid hospital being sued. The hospital is free from suit because all these patients had COVID and the statute of limitations has passed. You are a $1 billion company that forgives millions in debt every month. You can afford the cost to do an independent evaluation. Your quality review committee missed this gross lack of standard of care twice. Something in their procedures is off, and they just can't see it. Your choice is to join the cover-up or find out how this excellent hospital got dragged into such deplorable care. I am asking for a motion to create an independent panel of at least 2 doctors, one chosen by the patient's family and one by the hospital. This panel will review the non-COVID cases brought to the board last year and present their findings to the board. The doctors are to be paid equally for their time. The cost will be limited to $100,000. The hospital cannot ask to be paid for records requests, and the records shall be sent in a scannable electronic format. Any doctor whose patients are being reviewed has the right, but not the obligation, to discuss his case with the panel doctors.
Next up is Thomas Peter, followed by Vicky Nice Wonders.
Thank you. I'd just like to say I've been a citizen of Sarasota. My name is Thomas Peter since 1987. I had the incredible privilege of visiting your ER last month. What happened was I took a bad fall, popped my clavicle, was lying on the ground, I'm looking over and I see this bone protruding and surprised in the ER. The ER was extremely professional. Doctors were excellent, nurses were excellent. It was a very good experience considering those things happened. What was really interesting was that they hooked you all up with all the cadetry. I'm not a doctor. And you've got tubes and stuff and making sure you're okay. And they did blood tests. And there was an anomaly that came up that showed that I was in serious trouble. Dr. Gold, said, took a look at that, and he says, well, your heartbeat's good, your other blood looks good. I think that might be a mistake. Now that takes somebody with experience and knowledge and common sense in an ER room to see that and say, there's something wrong with this potential blood work. And so they redid the blood work. He got my old records from my local doctor here in town, which he was able to do. I was surprised at that. And they found out by the new test that that was a blood work that was wrong. It was incorrect. And they were ready to do all kinds of things to be at that point. So my point is that these are excellent doctors, excellent care, and excellent facility. We are so lucky here today to have this public discourse. That's really a good thing. I know that it takes up your time, and I apologize for that. But if this was a for-profit hospital, we wouldn't have any of that discourse. There would be no review of anything. They wouldn't have a first-class ER like we do. Which is, I mean, really, it's the truth. There would be no neonatal nursery or ward. Those things wouldn't exist. We wouldn't have a research hospital. We are really fortunate to have a public hospital here. And as a citizen, I want to fight that stays the same. And I want to thank you board members who wanted to see this as a public hospital and stay a public hospital. I want to thank you for what you're doing, the time you're spending, and your patience listening to people like me. So thank you very much.
Thank you. Vicki?
Good afternoon, everybody. I'm Vicki Nice-Swander. I live in Sarasota County. I'm a retired public health professional. Ran many programs in my career. I think you probably all know that public health in the state is grossly underfunded, and we're close to the bottom of the list of funding. But I see that Sarasota Memorial Hospital is doing exceptional community service work here, and I'm very proud of it, and I've had a very good experience every time I've worked with this hospital. I do want to bring up one comment though. Years ago, I used to be able to watch the meetings on television, and I was wondering if you could review that again and maybe provide that again. I found that very useful, and there's certain aspects that I particularly focus in on, and that would be probably very useful for the community as a whole. So if you could get a response to that to us, I greatly appreciate it. Thank you.
Just as a follow-up, I believe the meetings are still on YouTube. The same way they were about 3 or 4 years ago, I think we were referring to, so what that's. It's now on YouTube, yes. I think when you're thinking about this during COVID, we had it on WebEx. Before. But they can't be reused.
You may be referring to a time when Sarasota County had a channel 19 and they contemporaneously broadcast that, or sometimes on a delayed broadcast. That just doesn't really exist anymore for this board, but we do try to post them within a day or two fully on YouTube so that they can be reviewed at the leisure of the community.
Okay, thank you very much.
That was our last speaker. Thank you, everybody. Appreciate your comments. Caroline, do you have any legal business? Do you have any other business that you would like to discuss? Just switch on the hot.
Other business, I see Carol mentioned before other business, but I can do other business now. I had, last night I had some members of the community transmit a proposed motion to me, which I distributed to members of the board and to the president and to yourself. Went upstairs and looked to Caroline. And basically the essence of the motion is to put an entry on the hospital website in support of the Surgeon General of Florida and his advice. So that's the essence of the motion. And if you want, I can read it into the record at this time. It's up to you.
I think the law requires that we have full public time available for this. Can we push this on to the next agenda?
So you're saying in 2 months?
Yeah, I think this is a lot of information for us to review currently. I think it would be nice for us to have this right away and be able to review it before we're making an opinion.
Right, as long as we can have it at a public meeting and not in a committee, that would be fine.
Maybe first.
You can do that.
Yeah.
You can put this in quality and also bring it to the public.
This way it could be noticed.
Yes, exactly.
That would be fun.
Any other business? Okay. Meeting adjourned. Thank you, everybody.